My name is Mark Baldassare, and I'm a senior fellow at the Bedrosian Center on Governance at the USC Price School. Thank you for joining us today. The USC Price School is pleased to present this discussion on Proposition 1 on the California March primary ballot as part of our Political Pulse 24 series. For today's program, we will hear from three leaders and experts: Andy Imparato, Executive Director, Disability Rights California; Brittney Weissman, Executive Director, Hollywood Forward; and Saba Mwine-Chang, Managing Director, Homelessness Policy Research Institute at USC. Thank you for being here. Before we get started, there are a few items I want to make sure the audience is aware of. First, the USC Price School is hosting today's program and the Political Pulse 24 series to give Californians a better understanding of the issues they will be deciding on the ballot this year. Second, the USC Price School does not take or support positions on any ballot measure. To ensure fairness, Andy, Brittney, and Saba will limit their responses to a maximum of 2 minutes. The speaking order for panelists will begin alphabetically, with Andy, then Brittney, and Saba for the first question, and alternate with each question. So with that, let's begin. Proposition 1's title is authorizes $6.38 billion in bonds to build mental health treatment facilities for those with mental health and substance abuse challenges, provides housing for the homeless legislative statute. This is a long ballot item coming out of 2 pieces of state legislation. My first question for our panelists: what are the problems that Prop 1 is trying to solve? And what's at stake in the outcome for California and Los Angeles County residents? So Andy, if we can start with you.
Yeah, thank you, Mark, for inviting me to be part of this and for focusing attention on this important issue. I watched the press conference when the governor announced this initiative at the beginning of the legislative cycle last year. And I remember one of the speakers was Mayor Steinberg, and he said the problem they were trying to solve was to clear tent encampments. That was a big focus for him. I think if you look at the advertising and you look at all of the things that have been written about Proposition 1, it feels like they're trying to solve a lot of problems. There's information about improving places for veterans to live. There's information about solving a mental health crisis, big picture, for the state of California. There's information about trying to build out more housing and more facilities, more beds for people to go to. But I think fundamentally, the problem that we need to solve as a state and as a political culture is we need to have affordable housing, and we need to have services that are culturally competent, that are centered on the person who receives the services, and people need to be able to recover. They need to be able to get on a path to recovery. And I feel like if the governor took an approach where he heard from multiple stakeholders, experts in different aspects of this problem, we could have come up with a better solution that addressed all these problems at once. Unfortunately, the solution we came up with is very top-down. It's going to crowd out services that people are currently getting to help them with their mental health. And the beds that are being created, many of them are going to be created in locked facilities, which raises serious concerns about people's civil rights. So we don't think that the problem of clearing tent encampments was the right problem, and we don't think that this proposition is actually going to solve that problem.
Well, thank you, Andy, and thanks for keeping your comments to 2 minutes. We'll follow up on some of your points, but Brittney, let's hear from you on this.
A few things. One, I agree that we need to build out a more robust system of mental health care for everyone in the state. I think that Prop 1 goes a far way to helping us reach that. I have worked beside the LA County Mental Health Department for over a decade and am a mental health commissioner in LA County as well for almost 7 years. I also led NAMI, the National Alliance on Mental Illness, for almost 9 years. And during my entire tenure here in LA on mental health, the number one issue anyone ever raises is Where can my loved one live? Where can I live? I live with a mental illness. What do I do when my parent, spouse, partner, caregiver passes away or is no longer able to care for me? I need to have a place to receive services and I need to have a place to live. Prop 1 allows us to build out this continuum of care that never came to be realized after we depopulated the state hospitals. And what we're seeing in LA, at least, is that there's quite a resurgence of people living inside of the jail with mental health issues that cannot be attended to. They cannot achieve recovery inside of that jail. And if we're going to do anything to fulfill the promise in LA County of care first, jail last, we have to depopulate the jail. People with mental illness make up that population is about 5,100 people today in LA County Jail who deserve treatment in the community in a hospital bed with doctors rather than probationers or sheriff's deputies, et cetera, and behind bars. And so what we're looking to Prop 1 to do is to finally build out this continuum of care where people can receive the necessary medical treatment they deserve to live whole and full lives and get them on the route towards achieving all of that success. I would also say that outreach and engagement in the current way that MHSA is organized is not sufficient to meet the dramatic need on the street. We have people who live on the street who die, 6 of them almost every single day in LA, who are unhoused and also deserve this mental health care and a place to receive it.
Thank you, Brittney. Saba, what are the problems Prop 1 is trying to solve and what's at stake in the outcome for California and LA County residents?
Thank you so much for this question. In recent years, we've really seen the state really seeking to respond to the issue of homelessness, I think in more depth than in the past. I mean, as many viewers know, a lot of the kind of support to address the issue has come from, like, for example, here in our region, the county and the city. And so to that end, I think, it's really nice to see the state get more involved. I'd say that they're really seeking to solve the issue of unsheltered homelessness in our state. We have a high percentage of people experiencing unsheltered homelessness. 68% of people in California are experiencing unsheltered homelessness, which means that they're living outside in tents, cars, or other makeshift shelters. And I think it's also trying to address this shortage that we have in adult psychiatric beds, which is around 8,000, that this prop will address. And I think, and the reason why, we've also seen the state kind of look at other, bring forth other legislation, such as the care court, which I think Andy was referring to slightly in what he shared, which allows family, close friends, first responders, and behavioral healthcare workers to petition a court to compel a person with serious mental illness into a court-ordered treatment plan. And I think that for sure is sort of trying to address the issue of the intersection of unsheltered homelessness and serious mental illness, but also substance use disorder, which I think is really a vital part of the puzzle. I think in terms of what impact it could have on Californians, I think, like I said, it's positive that these services are expanding to include substance use disorder treatment, because that recognizes that that mental health challenges and substance use disorder sometimes occur together, especially when people experience the trauma of unsheltered homelessness. Sometimes it's really difficult. For example, folks who I remember meeting a gentleman who had shared he was a father of a young child. He fell into unsheltered homelessness, and he had to use substances to stay awake at night in order to protect his young child. And so, and I'd say another positive aspect of the proposal is the prioritization of treatment facilities and supportive housing. So I think these things are good. One of the main issues is that with a reallocation of funding, it could turn out that some community-based organizations end up having to close their doors because they don't have that stream of funding that they once could rely on.
Saba, thank you very much. I think in all of your responses, we got a sense of what the general issues are involved with Proposition 1. And we also got into some of the specifics. But I'd like to delve into the specifics a little bit more. You know, I do a lot of public opinion polling around the state. And I was struck by a poll that I conducted recently that found that 3 in 4 Californians say that the ballot wording is often too complicated and confusing for voters to understand what happens if a ballot measure passes. So for our audience today, I would really like for each of you to provide a summary of what are the fundamental aspects of Prop 1 from your expert perspective. You know, how much money, from where, for what programs and people, what time frame? I know there's a lot to unpack there, but hopefully between the three of you, our audience will get a sense of the specifics involved in terms of how much, from where, what programs, what people, what time frame. Brittney, let's start with you.
I thought it might start with me. I will say that the current Mental Health Services Act has, say it's a pie chart in your mind. It has several different pieces of the pie that fund things like workforce education and training, community supports, prevention and early intervention. What BHSA does is it loops in a whole entire new population of eligible people to receive services. That is the people.
Excuse me, but for our audience, could you, with those initials, could you spell it out for us?
Yes, prevention and early intervention.
Yes.
Community supports and services, and workforce education and training are 3 of the funding streams of the current HSA, the Mental Health Services Act, which BHSA is looking to revise. Okay. And substance use people with substance use only disorders will be now receiving services through BHSA, and BHSA will reallocate that pie, essentially blow up what currently is and recreate a new pie that really focuses and forces the counties to center and prioritize people who are the sickest of the sick, people who are disabled or unable to function and live their fullest lives due to their serious mental illness. It forces the counties to create housing, to create full service partnerships and invest more highly in those. There's a very strong evidence base that they help people who are the sickest of the sick to achieve further recovery. And then it also has behavioral health services and supports, which will assume quite a lot of the original MHSA pie. So in the way that it's restructured, there's a little bit more flexibility between these categories in BHSA than there was in MHSA, which may be helpful to counties looking to shift up or down on any of these levers. And so the county will be able to move forward with these 3 different categories. It may be more restrictive and force the counties to Saba's point about reallocating some of the dollars, so long as the community-based organization is really prioritizing the target population of seriously mentally ill. I think they should be able to find a way to fund them, because the whole point of BHSA is to lift up that population to receive the care that they have not been receiving under MHSA.
Mm-hmm. Thank you. Saba, can you add to that in terms of the specifics?
Yes, and hopefully my internet won't interrupt me here. Okay. So basically, this prop is amending the Mental Health Care Services Act, which was established in 2004. And it's divided into two parts, which we were just hearing about from Brittney, the Behavioral Health Services Act, as well as the Behavioral Health Infrastructure Bond. And so if passed, Prop 1 would dictate counties to receive closer to 90% of MHSA dollars rather than the 95% under the current law, essentially giving the state closer to 10% of MHSA tax dollars rather than 5% under the current law. And so approximately $140 million would be redirected to the state budget annually. If passed, though, this bond infrastructure would really fund a lot of development of behavioral health treatment and residential facilities, and some amount of supportive housing for veterans and people at risk of experiencing homelessness that have behavioral health challenges. So, that's good. I mean, we know that there is that huge deficit of those behavioral health beds. And we also know that those beds are not permanent housing. And we know that permanent housing and ideally permanent supportive housing really can end chronic homelessness. So that's something to keep in mind about this particular prop. I think the other thing too is that the way that it will influence counties will depend county to county. So say, for example, a county that may be in a rural part of our state, that may be perhaps, and not even being rural necessarily would characterize them as having less unsheltered homelessness, but perhaps there's a county that, really relies more so on those prevention community services versus, having a great need for these behavioral health beds. So it will depend on county to county how this kind of plays out.
Thank you. Andy, what's your perspective on the specifics? What are they, and what programs and people in Prop 1?
Sure, thank you. Let me just add some things that haven't been talked about. One, the funding for the Mental Health Services Act and what will now be, if it passes, the Behavioral Health Services Act, comes from a 1% millionaires tax in California. And that funding goes up and down because, the population is not static. By adding folks who have a primary substance use disorder, we dramatically expanded the population of folks who can receive services under that funding, but we did not increase the funding. So, I think it's a really good question. If you listen to a lot of the stuff that Brittney described in terms of the services that are needed and that Saba described, it's an interesting question. Why aren't we changing the formula so there's more money coming into the system so that there are more services available, especially if we're expanding the population? And I think Brittney might say, yeah, but we're focusing the money on people with serious mental illness. I have lived experience with bipolar disorder. I don't know that the term serious mental illness makes it clear who the population is that we're trying to address. Like the ramifications of your mental health are not always clear on the front end, that it's going to develop into something more serious. And the supports that you get and the things that happen to you early in your trajectory with your diagnosis can have a huge impact on your recovery and what you can achieve in your life. So I'm just not sure that serious mental illness is going to help us define the population clearly. And I do think that it's hard to require every county to spend 30% on housing interventions, serve a whole new population, and not have cuts in services for people that are currently getting services. The state will argue, well, there's other pots of money that can be tapped into for that. But I feel like this is a really important thing. If we're going to dramatically expand the population, then we should have more money going into the system. And then I just briefly want to touch on the bond issue, because at the very beginning of this legislative process, the governor and the legislative champions all said, this is to build beds in unlocked facilities. We're not trying to build institutions. We're not trying to build locked facilities. And then at the end of the process, they said, oh, actually, we can use it to pay for locked facilities. the nature of a bond issue is basically the state is getting money that it's going to give out in grants to build these locked facilities. And then the taxpayers are going to have to pay back the bond. So we're going to be paying back this bond for a number of decades. There are going to be individuals who build these facilities who are going to make a lot of money with a grant. It's not a loan, it's a grant from the state to build the facilities. So from my perspective, it's really important, what kind of facilities are we building? Let's build facilities in the community where people have integrated full lives in the community. Let's not build institutions and warehouse people and go back to our state's history of locking people away and forgetting about them. So I just think it's important to recognize that we have a new population, we don't have new money, and we made a change late in the process that gives us reason to be concerned about the bond and how the money is going to be spent.
Thank you. I think that we all know a lot more about the specifics, including me, having heard from the three of you. I want to touch upon something which each of you now has mentioned in passing, but I'd like to get more of your perspective on this. When people vote for a ballot measure, they want to vote for something that they feel like is going to make a difference, right? So I was really moved by Kaiser Family Foundation's survey that I read not too long ago that said 90% of Americans think there's a mental health crisis in the United States. I mean, that was amazing. So starting with Saba in this case, I'm going to ask you, why do you think Prop 1 will or will not have a significant impact on the mental health crisis in California and Los Angeles today?
It's hard to say. I think, this prop, and without knowing the context of what you shared in terms of the mental health crisis, I mean, I don't know, when I heard you say that, it made me think of just the sort of collective trauma that we all experienced in the pandemic. But in this case, I think, notwithstanding people who experience housing precarity and homelessness and unsheltered homelessness, I think in this case, this prop is really geared specifically to those people. What I think is that we need to have lots of options for care because people's needs exist on a spectrum. And I'd say, particularly in our state, with the issue of homelessness, we do need everything on the spectrum. And we do need to provide choice. In fact, that's a huge kind of principle of trauma-informed care that we need to consider as we're, creating these new opportunities, new fund, or, reallocating or moving together collectively as a state around these issues. And so to the extent that we can do that collectively, I'd say is what's really vital. And the other piece is housing. I mean, imagine, if you are experiencing a mental illness of any level, and you literally don't have a place to heal, you don't have a home to put your head down at night and feel safe, then that's going to certainly impact your mental health. And with the huge shortage of housing in our state, that's an issue for all of us. And so I think moving forward, we really want to have more investment in that problem at a state level, including what we're continuing to do locally.
Andy, why do you think Prop 1 will or will not have a significant impact on the mental health crisis?
Well, I think it's helpful to recognize that if we want to improve people's mental health, we need to listen to people that are experiencing mental health challenges and ask them what they need in order to recover, what they need in order to rebuild their lives. And again, if you go back to the press conference when the governor announced this initiative, there was nobody who spoke from a position of lived experience. They did not have one speaker. We have a whole peer-led system in California, organizations like Cal Voices, Mental Health America of California, the California Association of Mental Health peer-run organizations, not only were they not part of developing this proposal, but they've opposed it, and they have not been listened to by the policymakers. So from my vantage point in the disability community, we have the idea of nothing about us without us. If you're going to do something that's about us, make sure we're at the table. I don't think the governor or the state legislature tried hard enough to hear from people with lived experience and try to address the concerns that people raised in the process. And it's sad because the original Mental Health Services Act came from a broad coalition that included peers. Peers were excited about the Mental Health Services Act, and it requires counties to engage with people with lived experience when they're figuring out how to spend the money. So that's a bedrock principle of the Mental Health Services Act, and the development of this modernization proposal did not live up to that principle. The last thing I'll say is, in the disability community, we have the idea that disability is a natural part of the human experience. It doesn't have to be a negative thing. It doesn't have to be a tragedy. Mental illness is a natural part of the human experience, but a lot of people who get a diagnosis, they're not exposed to the idea that you can have a full life with this diagnosis. A lot of times it gets boiled down to, here's the diagnosis, here's the drug or the medical intervention that you need. And the system that serves people with mental illness often doesn't take a holistic interdisciplinary approach that really helps people build back their lives. Peers play a huge role in that system. People who've walked the walk, been through that experience, have a lot of credibility. And we're very concerned that this modernization of the Mental Health Services Act is going to make it harder for peers to get funding to play a role in this system. So I do not think that this proposition is going to solve the mental health crisis in California, and I don't think that's what it was intended to do. It's intended to clear tent encampments, and I'm not sure that clearing those encampments are going to make lives better for people if they end up rotating through a system and back out onto the streets later.
Thank you. Brittney, what's your perspective on this?
You started by suggesting that like 90% of the population thinks that there's a mental health crisis. And I would venture to say that in Hollywood, where I work every day, 100% of the population believes there's a mental health crisis. And that's probably true for anybody in downtown LA and Venice and other pockets of Los Angeles County, where a small fraction of people who live with mental health conditions, who are the highest utilizers of the public social safety net, will not voluntarily walk in to receive mental health treatment and don't know that they might be better off for receiving it. So Prop 1 is actually creating a whole system, building out a system of care for people to access outside of jail. Because without building out this system of care outside of jail, we're not going to make a dent in people who cycle through jail and hospital, who die on the street. And literally, this is what Prop 1 is seeking to mitigate, is to build resources so that when we make decisions about care, and I'm not a clinician, but I do know that some clinical decisions and treatment plans are restricted by the resources available to treat that diagnosis or the clinically indicated thing. People cannot access beds in the community or housing that heals, which could be fully complementary and kind of the spirit that Andy is discussing, because resources are so constrained, the wait list is too long. They're stuck in the bottleneck that is the higher locked facility beds, and also the bed that never says no, which is jail, totally behind bars, without the kind of structure and care necessary. And so I'm talking on behalf of the people, the smaller fraction of people on the street in the jail that deserve a better alternative and the right to treatment. And the current system is unable to meet their demand. And we are failing as a society because we are dooming them to lives of bars and carceral treatment. Hospitalization is not these things. The right to pursue a full life is not these things. And without places for people to go to receive this community, this care, we're going to be maintaining the status quo, which we've agreed in LA at least is not tenable any longer. And so I think that's my 2 cents on this topic.
Thank you. I think from the three of you, we get a good sense of the impacts As I mentioned at the outset, Proposition 1, which as somebody who studies ballot propositions is a very interesting and unique kind of a ballot proposition from the legislature because it has two parts that together the voters will decide what to do. And I want to take each of the parts that come out of the legislation together. First, let's talk about the fact that Prop 1 would change Proposition 63, which, as we've referenced here in our conversation, it was a legislative initiative on the ballot in 2004, 20 years ago, that passed by California voters with a 54% yes vote. And that measure was titled Mental Health Services Expansion Funding and a Tax on Personal Income Above 1 million. We heard Andy refer to it as the millionaire's tax. So I'd like to hear first from Brittney and then from Saba and Andy. From your vantage point, okay, so we're changing Prop 63. Has it been mostly a good thing or mostly a bad thing for California and LA? And what's going to change?
Well, Prop 63 has 20 years of evidence, 20 years of proof of concept, 30 billion in revenue generated to show for it. And when I suggested that 100% of LA County residents should feel like there's a mental health crisis, I would think that LA County should demand better results and outcomes. That what we see as we walk to school with our kids, go to work for the day, grab groceries, is not the population that needs the treatment, that is not receiving the care. I would think that the Mental Health Services Act, after 20 years and 30 billion in, would have more positive outcomes. I know that plenty good has been done with Mental Health Services Act. A lot of community-based organizations' livelihoods are tied closely to the Mental Health Services Act. A lot of stigma reduction and discrimination work is done. Early intervention and prevention work is done. Excellent. We also have a whole outpatient services side that is mostly supported by and matched by Mental Health Services Act dollars. So a lot of good. But I would point out that there has a mighty stack of reports at this point that demonstrate that MHSA has failed time and again over several years. And I would point you to the Little Hoover Commission report. There's a whistleblower report on Mental Health Services Act. There's a state audit by California itself that demonstrates that Mental Health Services Act has not proved its purpose. And then also hearkening back to the advent of Prop 63. No one ever thought that Prop 63 should be meant to, I see cases online, buy ham sandwiches or hold yoga retreats, et cetera. And I'm not saying that's what's done with every Prop 63 dollar, but to the extent that we're sharing dollars in those ways, we're denying access to care for people who need this medical treatment. And so I think that Prop 1 is kind of swinging the pendulum back more to the center than as we've drifted away from the people in the highest need when Prop 63 was created. Not to mention that Prop 63 came on the heels of depopulating the state hospitals, closing down a whole public mental health system that existed, that was never retooled and recreated and reimagined. And Prop 1 will help us towards that. Something more like the housing that Andy's describing with full supports, supported employment, services on site. We need all of that. We need both and I think Prop 1 helps get us there.
Thank you. Saba, how will, what are your thoughts on Prop 63? Mostly a good thing or mostly a bad thing? And how will it change?
Thank you. And thank you so much, Brittney, for all, and Andy, for all of your perspectives. So, I think what we've seen as a result of our huge, unfortunate share of unsheltered homelessness in California recently is sort of a focus to addressing that issue, which is absolutely, appropriate. And while we have this incredibly obvious issue on our streets of our neighbors experiencing homelessness right on our sidewalks, we also have to recognize that this issue of homelessness is one that is constantly churning. So I think it was like in 2022 that LASA reported that for every 25 people a day that are getting housed, or sorry, for every 20 people a day that are getting housed, 25 more people are falling into homelessness. And so really the issue needs to attend to prevention as well as, the crisis that we're in. And thirdly, sort of a long-term plan for building up housing across our state, and not just we certainly need more affordable housing. It's very difficult for affordable housing developers to get their projects cited, to get the funding for their projects. So they have to have multiple funding sources. But we actually need housing at all levels of income because of that issue of people falling into homelessness on a daily basis, and because of the high rents that we have here. And so I'd say, no one can say exactly how things are going to change with this prop. Perhaps, it's helpful for us to have this conversation today and to source all of the resources and to talk to folks who, have really a good awareness and understanding of how MHSA has played out. But I'd say that there is in our region and in our state a greater focus and I'd say this at the state level for sure, on this piece of crisis, and certainly in our city, we're seeing a lot of efforts in encampment resolutions, and we're trying to illuminate best practices with that as well at HPRI, and certainly there's a really important study that our members, a couple of our members have done called the PATH survey, which is, just hearkening back to what Andy said about engaging people with lived experience. This is the longitudinal survey that people who are currently experiencing homelessness can, fill out that survey on their cell phones and answer questions about their experiences. And so we need to make sure that we're engaging folks who have those experiences, and we're attending to prevention as well as crisis response.
Thank you. Andy, what can you add for us about whether Prop 63 has been mostly a good thing or a bad thing, and how's it going to change?
Well, one thing I want to emphasize is the Mental Health Services Act was not the Unhoused People Services Act. It was not originally written to be a solution to homelessness. It was originally written to be a way to provide better mental health services at the county level to people who needed them. And if you go back to the guiding principles of that original legislation, I think the guiding principles are still very relevant and good guiding principles for mental health policy in the state of California today. They include things like community collaboration, centering the voices of people with lived experience, cultural competence, that it should be client-driven and family-driven, recognizing that sometimes what the client wants and what the family wants are not always the same thing, and that it should have wellness, recovery, and resilience as goals and self-determination as a goal. These kind of guiding principles, I think, are good guiding principles. My sense from talking to people that I was in Washington, D.C. when a lot of this was being implemented, but my sense from talking to people that lived through the implementation is that with the economic downturn in 2008, a lot of counties were really strapped for money, and they tapped into these dollars to fill in for things that they used to pay for with other funds. So some of the things that the Mental Health Services Act was designed to add on to new services ended up not happening because the money got tapped for other purposes. And I know some people feel the state has not done a great job of oversight of the counties to make sure that the money is being spent for its intended purposes. So I would say it's a mixed bag in terms of whether it's been successful, but I think the goals that were laid out when it was passed are still the right goals for mental health policy in California.
Andy, I want to stay with you for a moment before we go to the Q&A and ask the three of you, starting with you, to tell us about the bond, the $6.38 billion bond. Can you explain how this money will be spent and why, in your opinion, this is a good time or a bad time to pass those bonds? I'd like to hear from each of you. And then we'll go to the audience questions. We've got some good questions, and let me encourage others to send their questions too.
Yeah, I think we've talked a little bit about it, but one thing that I haven't specifically addressed, which kind of goes to your question about whether this is a good time or a bad time to do the bond, is this bond, this funding to support building treatment facilities, including locked treatment facilities, is coming after two very important developments in state policy, and Saba referenced one of them. We passed Care Court 2 years ago, which created a new court system for ordering people into care. It's primarily focused on people with schizophrenia or psychosis. It's a brand new thing that's being implemented in 5 counties, and it's going to expand. And then more recently, we expanded the definition of grave disability, which is the standard for when somebody can be subjected to a medical hold against their will and subjected to medication that they may not choose to take. So it's important to recognize that all 3 of these things were developed by the governor and the big city mayors without input from people with lived experience. All 3 have been very adamantly opposed by the organizations led by people with lived experience. And the 3 things together point to a much more carceral approach to people with mental health disabilities in California. And we believe, if you look at schizophrenia, Black people are much more likely to get misdiagnosed with schizophrenia than others. We're worried that this carceral approach is disproportionately going to impact Black and Brown and Indigenous people in California, and that there's a racial justice element here too that we need to talk about as a state, and we need to monitor carefully as these things get implemented.
Thank you. Brittney?
Yes. So on the bond, it's $6.4 billion, and I want to get it right, so I'm going to refer to my notes. It's $2 billion for supportive housing, and then $4.4 billion for the building of 10,000 mental health treatment beds and 27,000 outpatient beds. And these include peer respite beds, crisis residential, drug treatment, dual diagnosis beds, because we have this new population as well. So these include community beds, acute and subacute beds. I want to make the case that California has fewer psych beds than the city of Cincinnati. Think of our population. Think of yourself in Southern California, and think of Cincinnati, the city, and how disproportionate and how we're discriminating against people who need these beds by not providing access to this life-saving care. Because if they don't move through the system of care and find their right treatment at the right time in the right place, they'll never make it through. They need supports that will be provided through developments through this Prop 1. And then on the comment about inequities that Andy just started to discuss, I would say that we know that the highest utilizers of the public social safety net here, and the highest, I would say, the most disproportionately impacted populations inside the jail are people of color in LA County. Of all of the deaths inside of our jails in LA County, the deaths are of people of color most dramatically, most disproportionately, because they cannot access care in the community. People on the private sector, with private health insurance, may be able to access the private bed supply, but people who receive care through the public social safety net, who may more often be people of color, do not have access to that private bed supply. They are the folks who are boarded in emergency departments for weeks at a time until something opens up that allows them to access a different level of care. And so the bond, getting back to the original question, will build out these facilities, these beds, so people don't have to do that anymore.
Thank you. Saba?
So, yeah, I really appreciate that this conversation has shifted to address the racialized aspect of homelessness in our state, which actually is similarly so in every state in America. Black and Indigenous people are disproportionately overrepresented in homelessness populations. And so understanding that homelessness is actually a race, housing justice, and an issue that is grounded in white supremacy culture. And given our inception as a nation, that was really birthed in land and labor theft, all of our systems are immersed in that issue. And so homelessness is really a outcome of multiple failing systems. So if you look in the criminal legal system, there's disproportionate Black folks. If you look in the welfare system, there's disproportionality there as well. And actually at similar rates to the homelessness system. So a lot of times, we think about these issues as and these systems as being separate, but they are constantly interacting. And in fact, it's a lot of the same people. But to think that, unfortunately, and thank you, Brittney, for talking about the opportunity for Black folks and people of color to gain access to beds. I think what we've seen is that just because there is available services, it doesn't mean that Black folks are going to be able to attain those services. Because of the issue of racism and how pervasive it is in our consciousness, really. So I'd say that any policies that we work on together in our state and certainly across the country, USICH put out a really great plan for the next 10 years called All In, that is really grounded in the fact that these issues are based on the issue of race. Homelessness is a race issue. And so we really need to begin to think of that across the board around all of our work. And we need to embed some opportunities for us to think about our biases. And systems are made up of individuals. And those individuals have biases that are grounded in hundreds of years of a caste system. And so, but I believe that if we can attach that understanding to everything that we do around homelessness, that we can start to address that issue more meaningfully.
Thank you. We have so many good questions because I think you three experts have generated so many good, thoughts during this time, and we're really short on time. So I'm going to ask each of you to answer one of the questions that comes in and see how that goes. So I'll start with you, Saba. One of our participants says, why does the statewide bill prioritize veterans over other demographic groups? Veterans represent roughly 5% of the total LA County homeless count. Any thoughts on prioritizing veterans?
That's a really good question. Actually, nationally, we've done quite well to address veteran homelessness. I don't know if it's sort of trying to adapt to that trend. I also think veterans are a very sympathetic population for most. Most people would say that, yeah, that's wrong, that people that have served our nation in this way would experience homelessness and not get the services that they need. So I know that locally there have been, I'll also say this, that I don't have the data in hand in terms of the intersection between the number of older adults that are veterans, but older adult homelessness is on the rise. It is, with the size of the baby boomer generation, as well as the high costs of housing when you're on a fixed income, it's really easy to kind of, lose your ability to maintain that housing. And so I'd say perhaps that is another area that this bill is seeking to attend to. But I mean, it is a great question because there are a lot of, for example, families. There are a lot of different populations that we could name. And that is sort of how our system is built around these various sort of categories of populations for good or bad, because, everyone needs support. And to the extent that we prioritize certain populations over others is problematic, I'd say, in some ways. But those are my thoughts around veteran homelessness.
Thank you. Andy, I'm going to give this question to you for a response. How much funding through MHSA for voluntary treatment will be shifted to forced treatment programs, i.e., how much moves from housing models to locked psychiatric facilities?
Well, as we've talked about, it's a concern. One of the concerns is that it's actually very hard to answer that question. Brittney did a good job of laying out all the different ways the bond money can be used. So we don't know how much of it will get used to build out locked facilities. That's why I brought up the expansion of the definition of gravely disabled and care court, because there's a cluster of policies that are happening together that give us real concern that more people are going to end up in involuntary or locked facilities. And I do think it's worth noting that if you have a really traumatic experience with the mental health system early in your trajectory with your mental illness, you're less likely to want to go back and get those mental health services. So doing the frontline treatment well when people are experiencing symptoms is really important to set somebody on a path where they're going to want to keep coming back for those services. And I know Brittney talked about paying for ham sandwiches or paying for yoga. I do want to say that what benefits a person's mental health is going to differ a lot depending on the person and the circumstance. And sometimes the clinical intervention is not the thing that is going to be the life-changing positive experience for the person with mental illness. I'll tell you, for me, having a healthy marriage and having a career are my two biggest mood stabilizers, much more powerful for me than medication or psychiatrists. So I'm not saying that Mental Health Services Act should pay for those things, but I do think part of the purposes of the law was to create innovation and open up new ways of helping people be well. And I don't think that's an inherently bad thing.
Thank you. Brittney, I'm going to give you this question, and then hopefully we have enough time left at the end for each of you to make some final comments. Please provide more details on how you think Prop 1 will impact children and youth. Much of the remarks thus far has focused on the adult population.
I saw that comment come in from Wendy.
Yeah.
So thank you, Wendy. Good question. From what I understand, prevention is going to get assumed by the state instead of locally handled here by LA County. Mm-hmm. And so we'll have to work on how LA County informs the state about what we need prevention to look like for us. I think there's some advocacy opportunity there. I think that with the California Youth Behavioral Health Initiative, it should offset some of the potential impacts, negative impacts to LA County youth services, et cetera. And I think that to the extent that youth providers center early intervention approaches, and a lot of what we deem maybe prevention could be tucked in nicely under this new early intervention category, I think we might be able to stabilize quite a bit. So I'm hoping that, well, actually I know, and I'm very proud that LA counties already have a lot of conversations and doing a lot of detailed work on how to shore up any potential negative impacts. And so I have a lot of faith that we'll be able to figure it out and maintain services as they are.
Thank you. So before we end our program today, I'd like to hear from each of you. What are 2 or 3 things that you want California voters to understand about Proposition 1 before making their decisions? And where can they find information that they can trust on how to vote for Prop 1?
Well, I'm happy to go. Thank you, Mark, and thanks for having us. What I would say is it's a really long proposition. It's really complicated. The ACLU is against it. Disability Rights California is against it. Mental Health America of California, lots of organizations are against it. And we're against it because it was developed without the input of the people that it's trying to help. And we think it's going to have a lot of negative, in some cases, unintended consequences. And it's not too late for us to go back and do it better. This is not our last opportunity to improve the Mental Health Services Act. So I would say vote no on this one and come to the table and make it better. And if you want more information about our opposition, it's on our website at disabilityrightsca.org.
Thank you so much for providing this space for us to have this conversation. I mean, you know, I haven't taken a position on the prop. I think, you know, what should really be noted is that this is not new money, and we do need new monies. I mean, you know, reform, and thank you, Andy. I agree. Like, this is sort of a shift and a reform of something that we've had, and that we can iterate on this again, hopefully as a state. But I think what I'd like to emphasize is that we need more dollars. And in fact, we know from a recent study called the California Needs Assessment put out by the Corporation for Supportive Housing. They did their homework and have shared in that report that it would take $8.1 billion to end homelessness in California. While that is certainly a lot of money for those of us that are on this call, it is just this very small fraction of the the California state budget, which is 225 billion. Or maybe I should double check that stat. I don't know if that's FY24. So we can do it, and we can do it with building housing. So we don't want to lose that opportunity, and I think we should continue to force and push the state to create a permanent source of funding to address the problem. Because one of the things that happens when we move money around, when we create short-term funding solutions, is that then the system has to reorganize itself in order to funnel through those dollars. And that's difficult. That's creating more complexity. It's creating more red tape. But if we had a permanent source of funding from the state, then we could really build our infrastructure in such a way to be able to push out those dollars and really comprehensively solve the problem from a prevention standpoint as well as a crisis standpoint.
Thank you. Brittney, final words.
Thank you very much for having me on this panel. I would say yes to more money, and yes to a fully funded, robust, full continuum of care for people who need it and who need mental health care. Absolutely. I also say yes to Prop 1, and I suggest you personally consider voting for Prop 1 as well, because it is the best chance at updating and modernizing our Mental Health Services Act and the system behind it. Without it, we are maintaining the status quo. We will not be able to depopulate our jail here in LA County. I am all for, care first, jail last, care first, homelessness last. And this measure, this proposition addresses both of those elements. And I think it's very thoughtful, and I have very high confidence that the County of LA and other counties will be able to maneuver in ways that make best use of Prop 1 and the flexibility, as well as help them implement SB 43, or in LA County, we have Measure H replacement coming up. And I think that all of these various efforts will tie together very nicely once passed, and we'll have to maintain our advocacy effort on the implementation side, because just the first step is the prop passing. And then the second step is really, what does it look like on the ground? What's got to change? Whose voices have to be heard? How do we leverage as much good as possible out of this new proposition? And how do we build real estate in expensive land in California? All of those kind of nitty-gritty nuts and bolts will need to be addressed. And I think that the stakeholder process should prove effective at addressing some of those too.
Thank you. Wow. We learned so much in an hour from the three of you, and I've never been part of a program that has generated as many questions and comments from the audience as this one did today. Obviously, this was a really timely and relevant conversation on a very important ballot proposition. I'd like to thank Andy, Brittney, and Saba for joining us today. And I'd like to thank my colleagues at the USC Price School for all of their help in hosting and organizing this timely event. And of course, I'd like to thank all of you for joining us today as participants on this call. So stay tuned for future Political Pulse 24 events to discuss state and local ballot measures in the November election. Thank you for joining us, and don't forget to vote in 2024. Please be safe and have a good afternoon. Thank you again.